So the equipment that you need for this exercise is either a small ball, a foam roller can work, a yoga block can work, or just a rolled up towel as well, or probably 2 rolled up towels together. And also some wedges. So you can buy wedges, Rehab wedges, but these are just door stoppers I bought from the $2 shop. And it worked fantastic. Okay, so that's what it looks like that I'm using. And the idea is it helps make the foot pronate, which helps the hip, helps the knees, and helps the foot of course too. So who would benefit from this exercise? It's anyone who has really high arches in their feet and also problems in their hips as well. So that is a link there. Someone who has high arch on one side, so they're kind of always living on the outer edge of their foot. And when they go to bring their knee in line with that'll make the knee sort of swing outwards. It'll make when they squat, the knee kind of wants to do this. Can be some hip impingement when you do that too. So people with hip impingements, this will be useful for. And when you go to bring your knee in line with your big toe, that outer edge wants to come off. So the foot is not very mobile in the midfoot. People who, when you twist the front and back of the foot this way, there's not a lot of movement. Some people have almost no motion there at all. The foot needs to be able to have a lot of motion in the midfoot. So this is very useful. People who have plantar fasciitis, this is useful. People who have chronic ankle pains, this is very useful. Knee issues, knees are nearly always, the knees are a victim of what's happening above and below. So the ankle and foot, or in the hip, or even the other side hip, how it's positioned as well can affect the whole other side of the body, the other leg. This is also very beneficial for people who have real difficulty trying to bend forward and the shin doesn't bend much. So you get to about here, and then when you do your squat, you feel like you're going to fall backwards. It can be to do with a long femur versus shin versus torso. It can make it very difficult to squat. However, it can also just be that your feet can't pronate, therefore the tibia, shin bone, can't internally rotate when you bend. When we bend the knee, the shin bone, not that you feel it, but it's meant to do it, it's called a coupling, rotates inwards, and the foot then, if I make it more obvious, pronates inwards this way. So that works as a team. At the same time, the hip needs to be able to internally rotate. So internally rotate, internally rotate. Pronation is a form of internal rotation as well. So if you find you really don't have much movement here, it can be sometimes, and a lot of the time, not just because you think you have tight calves or tight Achilles tendon, it's that the body can't access pronation of the foot and affects everything upstream. So it'll be like you go to squat and it's just like, and people looking at you going, go lower, and you go, I can't. Because the body can't access any more internal rotation in the lower body. So we do this exercise and you find, normally you're stuck here and it's like, you're going down heaps more and it feels easy to do because the body can suddenly access the pronation. This is also very useful for people who can only squat when they have their feet turned out. Because what that does, it gives a kind of pseudo pronation to the feet. The tibia doesn't have to internally rotate as much, whether on one side or both, and it's way easier to do. It can be to do with femur length as well. And also when you do your squatting, that you go down and there's a push to one side. So there's a couple of reasons for that. The main one is that if you're being pushed over this side here, it means that the right glute, it can't open up. It can't create clearance in the joint itself. So you need to open up the back of the capsule. Often it is though, the body rotates this way, can't access the back of the left glute. Can be also the body going into the stronger side, but it's usually because it can't access the back of the joint. So this is all reasons why this exercise will be very useful for you to do. So first of all, let's do an assessment for how good your squat is. So make it so your feet are hip width, the feet are straight ahead. Often feet want to be wider, about shoulder width or more, and the feet definitely want to be turned out, especially if you have issues in the lower body or the foot can't pronate, as it hides compensations. Then from here, you can bring your arms out if you like. It's probably a good idea to do. How low can you squat? So I can go all the way down here. A lot of people will get stuck here, or they'll get knee pain because the tibia can't internally rotate. It can't internally rotate because the foot can't pronate on that side. Plus, probably also, the femur can't internally rotate as you go lower as well. So that's the test. right there. See how low you can go. So from the side here, I'm pushing out as I go down. Feet staying flat on the ground for part of the test too. So we want the heel, center of the heel, knuckle of the big toe, knuckle of the little toe, that's known as the tripod, to have force and even weighting all the way through, which means that your weight goes through the middle of the foot here. So we're doing that for this test. Often people get to a certain height, the heels want to peel off. Worse still is that the knees come in and the outer edge pops off, or if you've got a real problem with the impingement, the knee will want to open up like this because the body can't create space where it needs to. And what we're doing with this exercise is affecting from here downwards, but a big focus with pronation in the feet, which is the internal rotation here. So where you won't get any benefit from this exercise, if you're someone, it's quite common, the ankle and the foot and even the knee is already massively flat. So some people have ankle, like the ankle is just not stacked over the foot. This won't help you at all. It'll probably make things worse, and you'll probably have pain here, lateral gutter impingement, and it'll probably make that worse as well. So that's who this isn't useful for. So how we set this up, we want the front wedge to go under the first metatarsal head, which is the knuckle of the big toe. It can also go under the second toe too, but really the first met head is enough. It'll get the result. The wedge at the back goes on the side, the outer side, and goes to, it can go all the way across to the other side of the foot, as shown in the picture. The back wedge goes on the outside of the foot. The idea is it's making the heel dive inwards, and this one underneath here is making the front foot do this, back foot does this. So there's a movement in the midfoot, this section here, forefoot, hind foot, midfoot. We want that part to twist, and that's where the pronation will be. So let's do a squat. So we did our assessment before. So let's go straight down, relaxing your feet. You may notice the tendons in your toes, your ankles. Maybe before they're flickering, maybe they're kicking on, trying to help, trying to figure out what to do. And then now they're silent, they're relaxed. You may find, gee, that's so easy. And that pain I had in my knee, that's gone. The impingement I had in the hip, that's gone. Okay, so we're on a winner already. So we just do sets and reps. Minimum 10 reps, going up to at least 20, building up over time. To make this even more effective and test this now, so you pop that, not really between your knees, a bit higher up, so the adductors get some of the input too. So I've got a little tiny squeeze, it's not much, maybe about a 3 out of 10 effort. And I'm going down, reaching forward, a squeeze, and you'll probably find that feels way better because it's actually getting a better forced closure of the front of the pelvis and the femoral head rolling inwards. What you could do to get a good squat pattern is to grab a weight plate, just a light one, maybe 2 to 5 kilos. You're reaching out as you go down. This will ensure that you're bending from the hip crease here. So from the side, a really good squatting pattern is as much as my hip goes back, my knees go forward. So it's that kind of motion here. A poor squatting pattern is the knees go forward and then this starts to go back, puts pressure in the knees straight away, unless that's what you're wanting to train, which is an okay thing to train. It's not good if you have knee pain or problems already though. So we want, as soon as you start, your backside go back, the knees bend. So there's a hinging, a bending from the hip. So the back has got what's called arrow spine. If I don't have arrow spine, it's this. The body locks into this arch position. This is the hip flexor dominant pattern. People usually have knee problems and back problems, sacroiliac joint problems. When there's this, before you even squat, the body goes, I'm going to use hip flexors. You can't even breathe properly. The diaphragm is not acting properly. Other one is people don't know how to hinge from the hip. So there's a bend. See, I'm rounded from here. That's not hinging, that's actually moving from my lower back. And that'll overload your back. If you put weights on your back, doing back squats, you'll blow out a disc. So a really easy way to do this, much as the hip goes back, knees go forward. So you get good at that, which means that the weight stays right in the midfoot. The weight of the foot stays through here. The weight of the whole body goes through this point here. Or you get the weight plate as you sit back. See how the pelvis, it goes back as you reach forward. It naturally makes this pattern happen. So that's another way you can train that. So I'm popping this between imaginary weight. Grab a weight for real though, if you need. And we're doing sets. Squats is such a useful pattern to do when you're training squats. You're training your neurology to go all the way down to the feet. The brain loves squats, the cardiovascular system, the heart. Getting strong in the legs is really, really important. So we want to do 3 sets, at least 3 sets of 10. We can load this by holding onto a kettlebell, dumbbells in the hands, barbell on the back. So 3 sets of 10 is a really good start. Then we can, until we get 3 sets of 12, add some weight, or we can build it up to 3 sets of 20, and then we start adding some weight. Going back to 3 sets of 10, 3 sets of 12, till we gradually build up to the 20 again, add some more weight, and gradually we can add more sets. So if you're doing just 3 sets of 10, it'd be worthwhile doing 5 days a week. Legs can be done every day, despite what people think, but you have to be really careful as you gradually increase the loading. It's actually really good for you to do that. If you're doing lots of heavy work, increased sets, lots of weight, you want to wait at least every second day doing the exercise, even waiting 3 days and doing the exercise then. Okay, so you're doing about 2 to 3 times a week if you're doing lots of weight training using heavy weights, that kind of thing. This can also be progressed by 1 foot putting the weight in that leg, bending the knee so you can't see your toe, coming back on a kickstand. So I've just got my toe touching, so I'm not putting weight into this leg. So all the weight's going through here, doing your squat pattern this way. The weight's still going right through the center of the foot. You can grab a chair and put pressure on the chair, so through your arms. It's a really good way to progress a single leg squat, building up to that. And gradually needing less force until you don't need force, then start putting weight in the hands through dumbbells. There will be a natural lean forward when you do this, of course. So that's working on a single leg squat. Of course, we can also lift that leg, lower yourself down, and practice that way as well. Going into a lunge position, pelvis a little bit tucked under. Same thing. So using a good form with the lunge. We go into split squats. And doing rotational exercise. So we're getting greater internal rotation. So I can grab a weight plate as I'm doing this.